Hi, my name is Hallie Power and I'm a student physical therapist assistant at Jeff State. Today, my patient in question is a 64-year-old female with a diagnosis of osteoarthritis of the left hip. Osteoarthritis is the most common form of arthritis, and it occurs when the protective cartilage around a joint wears down. My patient complains of left groin pain that usually presents as a dull ache, although it's sometimes sharp. And she also complains of stiffness, particularly in the morning and when changing positions. Objectively, the patient presents with a decrease in strength and range of motion of the left lower extremity. Concerning strength, she primarily has deficits with abduction and extension, while with range of motion, she has deficits with flexion and extension. With palpation, it was noted that the patient demonstrated hypertonicity of the left hamstrings. The first intervention we will be doing is soft tissue mobilization to the left hamstring. So I'll be using mobilization cream.
Is this going to be on YouTube?
It is going to be on YouTube.
Because that's where people get famous. Let me tell you, that's how Justin Bieber got famous.
Really? So we're using longitudinal technique.
What's that mean?
It means I'm running along the muscle fibers in line with the fibers.
Okay. I have no idea what that means, but it sounds smart.
That's okay. The purpose of soft tissue mobilization with the longitudinal technique is to increase tissue extensibility of the hamstrings, as well as improve range of motion, specifically hip flexion. During her initial evaluation, the patient was given the straight leg raise test, in which she was able to make it to 45 degrees with the left leg and 60 degrees on the right. Okay, and this addresses one of her goals for therapy, which is increasing hip flexion from 125 degrees of passive range of motion to 135. Next, we will be learning a home exercise, and so I'm gonna come right over here, and you can watch me. I'm gonna explain everything, and then I'll help you do it. Okay?
Goody, goody, goody.
Okay. So these are called clamshells, and what you're gonna do is you're going to lie on your right side. We're going to be working on the muscles right here with your left hip, and they're the muscles that bring your leg out to the side.
That looks painful.
It'll be all right. Okay, so you're going to have your feet and your knees together with your knees bent, and then keeping your feet together, you're going to lift your knee towards the ceiling. Okay? Now, a really important thing here is that you don't roll back with it. Okay? So you want to make sure that all the motion is just coming from your hip, not your body rocking back and forth. Okay?
I can do that. I can do that.
So up and back down.
I can do it.
Okay? And we're going to do 3 sets of 10. So knees are bent. We want to make sure your feet are in line with your spine. So that looks good. And there you go. Right there. Perfect. Okay, now keep your feet together and open up your knees like a clamshell. Good. And back down. Make sure you're not rolling back.
Up.
Mm-hmm. I'm going to keep all of this still. Good. You should be feeling it right around here.
Oh, I feel it.
Feel it?
I feel it. It's painful. Can we do something else?
We will move on to something else.
Good.
Right after
I
this.
like this.
Now, if you get to a certain height and it increases that pain in your hip,
It's painful when I
don't
do
go
that.
quite as far.
Oh.
Okay.
So if I go like this,
That's
little ones instead of big ones?
yes. That's
Okay.
much better.
That looks good.
It does look good. Do you have any questions about that?
Yeah, can we do something else?
We will. We'll do something else right
Great.
now. Regarding patient education, we will be discussing symptom management in order to decrease pain and stiffness. By being conscious of remaining in the same position for a prolonged period of time, as well as beginning her stretches early in the morning, we will ideally see improvement in her subjective reportings.
Oh,
Very well.
I did clamshells then.
You did very nice clamshells.
Thank you. I know.
You get to do those at home too. We're going to send you home with a nice little packet of exercises.
I thought it was just here.
You get to do them here and at home. We're going to really get you strong.
She's so fixed.
Okay, so what I want to talk to you now is about just some things you can do at home to kind of help your symptoms. I know you've been having pain and stiffness.
My back hurts
Mhm.
and my hips.
Yeah, especially in the morning when you wake up. That's really common with osteoarthritis. And so when you wake up in the morning, it might be good to start off the day with some stretches.
I usually start out the day with my yoga.
Yoga is good. We're gonna give you some stretches to take home, and you'll be able to do those. Also,
And
if you
coffee.
wanna, coffee's good. If you wanna take a hot bath, that will kind of warm all of your muscles
sea salt
up.
and coconut oil.
Sea salt and coconut oil. I highly encourage that.
It's so wonderful.
It is. I might do that myself when I get home.
good, you should.
Yeah, so you might want to start off the day with a hot bath, some stretching, and that'll get those muscles in that joint warmed up.
Okay.
Okay, and another thing, I know you have trouble going from sitting to standing.
That's only your opinion. I get up just fine.
Yes, ma'am. Well, some things to help with that. Try to avoid sitting in positions for prolonged periods of time. So I know you like to play on the ground with your grandchildren. So if you are
I
on
have
the ground,
4.
I'm sure they're very
all
cute.
girls.
You've
All
got a
girls.
handful.
Yeah, I'm proud.
Yes, ma'am. Well, when you're playing with those girls on the ground, make sure that you're not sitting in the same position for too long. That's going to start making that
How
joint
long is too
stiffen up.
long?
Maybe 5 to 10 minutes. Just keep that joint nice and warm. I know that usually makes it feel better when you get it warmed up.
It does, especially when I have like some massage in it too.
Yes, ma'am. Do you have any questions about that?
Am I famous? I know that y'all been videotaping me. This
Yes,
is great.
ma'am. Well, we're going to work on that. We'll see.
Y'all
after I get
come
my
watch
grade.
me in this movie. It's a movie, right?
Yes, ma'am.
Okay, great. Bye, y'all.
The patient will be reevaluated in 4 weeks and exercises will be progressed as tolerated. There is no cure for osteoarthritis, however, symptoms can be managed. Following her visits in outpatient therapy, it's vital that the patient continues her home exercise program indefinitely. If symptoms continue to progress despite conservative treatment, the patient may undergo total hip arthroplasty, in which the hip joint is replaced by an artificial prosthesis. It's important for the patient to continue strengthening of the muscles around the hip in order to protect the joint. This will also add stability and decrease symptoms associated with a wearing down of cartilage. Maintaining functional range of motion through stretching is also vital for performing transfers, activities of daily living, and ambulation. By continuing to be physically active and proactive regarding symptom management, the patient has a positive prognosis, and she may even have the chance to become a YouTube sensation.